There's something strangely ironic about life. When we're young, we trade our time for money. But as we grow older, we'd give anything, even all our savings, just to buy back a little time and a healthier body. After the age of 60, our bodies no longer stay silent. A stiff shoulder in the morning, shortness of breath on the stairs, a forgotten name or appointment. These small signs are gentle whispers telling us that our health has entered a new chapter, the chapter of fragility. Then one by one, familiar names like high blood pressure, diabetes, osteoporosis, dementia begin to show up, not just in medical records, but in quiet conversations over afternoon tea with old friends. But this isn't just another medical lecture. This is a heartfelt conversation, simple, sincere, and meaningful. A moment to reflect on the 8 most common chronic conditions in older adults, not to worry, but to be ready. Because when we understand, we fear less. When we listen to our bodies, they learn to speak to us more gently. Let's begin this journey together, not just to live longer, but to live healthier, more intentionally, and with deeper joy every day. High blood pressure, the silent killer behind a peaceful face. In the world of medicine, some diseases never knock before they enter. They don't cause sharp pain, leave no visible wounds, and often show no early warning signs. But that's precisely what makes them so dangerous. High blood pressure, also known as the silent killer, is one of them. It lives inside us quietly, sometimes for months or even years. It forces the heart to work harder with every beat, yet we feel nothing. Until one day it decides to act. A sudden stroke, an unexpected collapse, or a heart that stops in the middle of an otherwise peaceful afternoon. The story of Mrs. Evelyn, a fall triggered by a silent number. Mrs. Evelyn, 68, lives in a small, quiet town in England. She's the picture of a healthy elder, polite, careful with her diet, enjoys morning walks, never smoked, never drank. One ordinary morning, while pouring tea for her husband, Evelyn felt dizzy. Her vision darkened, her hands trembled, and she collapsed onto the living room carpet. Her husband rushed her to the hospital. Doctors diagnosed her with a mild stroke caused by a sudden spike in blood pressure. Evelyn had never imagined she had hypertension. She'd never checked her blood pressure because, in her own words, I always felt fine. The lesson from a moment that nearly changed everything. High blood pressure doesn't discriminate. It affects people of every background, rich or poor, male or female, slim or overweight. Even the ones who seem the healthiest can fall victim to it, especially when they ignore it. Most stroke victims due to hypertension have one thing in common. They didn't know, or they knew but didn't act. The solution: listen early to live long. Monitor your blood pressure regularly. Don't wait for symptoms to show. Control your salt and fat intake, eat more greens, and avoid overly processed foods. Exercise gently but consistently. Walking, light cycling, yoga, tai chi. Manage stress, sleep well, and make time for relaxation and peace of mind. Take your prescribed medication, and never stop just because you feel okay. High blood pressure is manageable if we choose to face it, but it can also become a gentle death sentence if we choose to ignore it. Don't let a quiet number steal the peaceful years ahead. Start today with the simplest step. Check your blood pressure. 2. Diabetes, the thief that steals a peaceful old age. Some thieves don't break into homes, don't force open locks, don't carry weapons, but they take from us the most precious things: freedom, vitality, and the peaceful joys of growing old. One such thief wears a sweet disguise: diabetes. People often call it the sweet disease, but its consequences are anything but sweet. Because diabetes doesn't just raise blood sugar, it slowly damages the kidneys, clouds the eyes, numbs the feet, and chips away at everyday life, one piece at a time. The story of Mr. David, a man who didn't know he was losing what mattered most. Mr. David, 71, a retired civil engineer from Canada, lived independently, enjoyed gardening and reading, and had always seen himself as in good health. In recent years, he had started feeling tired more often, experienced a dry mouth, and woke up multiple times at night to urinate. He thought it was just part of aging, nothing to worry about. One day, while working in his garden, he got a small scratch on his ankle. The wound refused to heal. It swelled, became painful, and eventually forced him to seek medical help. The diagnosis was clear and painful: type 2 diabetes, with early complications affecting his circulation and nerves. The doctor told him, if you had come in sooner, we could have prevented this. Now, David, who once walked freely through his garden, has to wear a leg brace and walks with difficulty. His independence has faded, quietly taken by something he never even saw coming. The lesson from a wound that wouldn't heal: diabetes doesn't only affect people who are overweight. It doesn't just come from eating sweets. It can strike anyone with a sedentary lifestyle, high stress levels, or a habit of ignoring early warning signs. The scariest part? In its early stages, diabetes often causes no symptoms at all. Most people only discover it after damage has already been done. The solution: take control early to protect your quality of life. Get screened for blood sugar regularly, especially if you're over 45 or have a family history. Eat a balanced diet. Limit refined carbs, sugars, and fried foods. Eat more whole grains, vegetables, and fiber. Move your body daily, even if it's just 30 minutes of walking. Manage stress, sleep well, and maintain a peaceful mental state. If diagnosed, follow your treatment plan, monitor your blood sugar, and care for your feet, eyes, and kidneys regularly. Diabetes doesn't take your life all at once. It slowly takes it away, little by little. Don't let small daily choices, like skipping exercise or ignoring fatigue, become the reason your golden years turn into years of struggle. Let your old age be a time of living fully, not just surviving. Heart disease. When the heart is no longer young, but we still keep ignoring it. There's one organ in our body that has walked with us through every chapter of life, beating over 100,000 times a day without rest, without complaint. That's the heart. But one day, that same heart starts to slow down. It skips beats. It feels tight, tired, heavy in the chest, perhaps during an afternoon that seems perfectly normal. And in that moment, we realize, my heart is no longer young. The story of Mrs. Grace, a breathless moment that spoke volumes. Mrs. Grace, 70 years old, lives in a quiet suburb in California. She spent her life as a strong, capable woman, rarely complaining about her health. Lately, however, she's been feeling winded after climbing the stairs. Sometimes she feels a dull ache in her chest, sometimes just a faster heartbeat than usual. She brushes it off, thinking, it's probably just age catching up, nothing serious. Until one morning, while watering her garden, she feels dizzy. Her chest tightens, like someone's squeezing it. She leans against the wall, struggling to catch her breath. At the hospital, she's diagnosed with coronary artery disease, caused by long-term hypertension and cholesterol buildup. The doctor gently says something that stays with her. Your heart has been speaking to you for a while now. You just weren't listening. The lesson from a staggering heartbeat. Heart disease isn't just for those who are overweight or obviously ill. It grows quietly through small habits we overlook every day. Eating too much salt, sitting too long, sleeping poorly, and above all, ignoring warning signs like chest discomfort, shortness of breath, fatigue, or palpitations. When the heart is no longer young, it deserves more love, not less. The solution, caring for your heart through action, not just words. Get heart checkups regularly, especially after age 60. Control your blood pressure, cholesterol, and blood sugar, the dangerous trio. Eat less salt and animal fats and add more vegetables, nuts, and omega-3s. Stay active. Brisk walking, deep breathing, yoga, or Tai Chi can work wonders. Protect your peace of mind because every emotion leaves a mark on your heart. Growing older doesn't mean your heart must grow weaker, but if we continue to ignore its gentle warnings, one day it might go quiet, forever. Start today. Book a heart screening, prepare a heart-healthy meal, begin one new good habit. Because when the heart is no longer young, it needs our protection more than ever. 4. Osteoporosis, the silent fracture of independence. In youth, every step is freedom. We walk without thinking, move without hesitation. But in old age, that freedom becomes fragile. One small fall, one invisible crack, and a lifetime of independence can suddenly disappear. That's why osteoporosis is one of the most silent, yet most life-altering chronic conditions in older adults. Osteoporosis doesn't come with pain or fever. It quietly hollows the bones that weakens them day by day, until one simple movement leads to a serious fracture. And by the time it's discovered, it's often too late. The story of Mr. George, the fall that shattered more than bone. Mr. George, 75, lives alone in a peaceful suburb of Sydney, Australia. A proud, independent man, he loves his quiet mornings, making coffee, doing his own grocery runs, tending his small garden. One evening, while stepping into the bathroom, he slipped on a wet tile. It seemed like a minor fall, but the x-ray told a different story. A hip fracture caused by advanced osteoporosis. After surgery, George needed a walker and months of rehabilitation. But what hurt most wasn't the fracture. It was losing the ability to live on his own. He had to move in with his son, and the loss of his independence was more painful than any physical wound. The lesson from a seemingly harmless fall. Osteoporosis usually shows no warning signs. Most people only realize they have it after a serious fracture. Postmenopausal women, thin individuals, and those with sedentary lifestyles are especially at risk. But in reality, anyone can suffer from osteoporosis if they take their bones for granted. The solution: strengthen your bones, safeguard your freedom. Get regular bone density scans, especially after age 60. Take calcium and vitamin D through food or supplements as advised by a doctor. Stay physically active with weight-bearing exercises, walking, light stair climbing, Tai Chi. Prevent falls at home. Install grab bars. Use non-slip mats. Ensure good lighting. Avoid smoking and limit alcohol. Both accelerate bone loss. A fall at 75 is not the same as a fall at 25. It's not just pain. It could mean the end of independence, of self-confidence, of the life you love. Take care of your bones, the quiet pillars of your aging journey. So every step you take isn't just a movement. It's a declaration. I am still free. I am still living on my own terms. 5. Osteoarthritis, the silent pain that follows every step. There are pains that don't make you cry out. They simply appear when you step down from a stair, when you try to rise from the couch, or when you hear the faint crack in your knee. It's the kind of pain that doesn't make you fall, but makes every step a challenge. This is osteoarthritis, a silent yet persistent condition that slowly takes away the mobility and joy of movement for many older adults. The story of Mrs. Helen, a woman who no longer dares to walk her usual path. Mrs. Helen, 72, lives in a small coastal town in New Zealand. All her life, she's been a lover of nature, taking long walks by the beach every evening, soaking in the sun and breeze. But recently, she started feeling knee pain every time she stands, especially in the mornings. Climbing stairs has become harder. Her legs, once strong, now tremble after just a few steps. After a visit to the doctor, the diagnosis was clear: knee osteoarthritis stage 2 with thinning cartilage. It's not that I don't want to walk anymore, she said. It's that I'm afraid I won't be able to make it back. The lesson from slowing steps. Osteoarthritis doesn't come suddenly. It's the result of time plus pressure, lack of early care. People who are older, overweight, have had previous joint injuries, or who work physically demanding jobs are at higher risk. And sadly, many simply live with the pain, thinking this is just what happens when you get older. The solution. So every step is no longer a fear exercise correctly. Gentle joint exercises like yoga, swimming, and stationary cycling. Control your weight, because every extra kilogram is an added burden on your knees. Eat foods rich in joint health nutrients, omega-3s, calcium, collagen type 2, and anti-inflammatory foods. Use joint braces or walking aids if needed to reduce the load on your joints. Visit an orthopedic specialist regularly. Don't self-medicate with painkillers for extended periods. When we're young, every step is freedom. As we grow older, every step needs to be protected. Don't let the silent pain of osteoarthritis steal your joy of movement, because when you can still walk, still take care of yourself, you are truly living your senior years with strength and independence. 6. Dementia, when memories fade. Memory is the most essential part of our lives, but there's something worse than losing what we hold dear. It's losing ourselves. When our memory starts to fade, when familiar faces become strangers, when we no longer recognize ourselves in the mirror, that's the haunting reality of dementia, a disease that silently steals the memories of millions. Dementia is more than just forgetfulness. It's the loss of thinking, reasoning, and interacting with the world. It makes daily life harder, erodes relationships, and sometimes it takes away the ones we love the most. The story of Mr. Charles, when memories become strange. Mr. Charles, 78, lives in a small village in London. He was a retired teacher with an impeccable memory and a life full of stories. Recently, though, he began noticing small things slipping from his mind. The names of friends, stories he used to tell, suddenly becoming hazy. One day, he found himself unable to remember the way home, even though it was a route he had taken for 40 years. His son took him to the doctor, and the diagnosis was clear. He had dementia, likely Alzheimer's disease. Mr. Charles was no longer himself. His memories slowly faded, replaced by a blur of confusion. What hurt most wasn't forgetting the past. It was not recognizing the people he loved the most. The lesson from a fading memory. Dementia isn't inevitable. It can be prevented if we take care of our brain health early on, engage in mental activities, stay socially active, maintain a healthy diet. And the most important thing, don't let the fear of losing our memory blind us to the small signs. The solution: protecting our mind, safeguarding our memories. Exercise your brain, read books, solve puzzles, play chess, or learn new things every day. Stay socially connected, join clubs, meet friends, participate in community activities. Eat a brain-healthy diet. Add omega-3s, vitamin E, and antioxidants to your meals. Reduce stress, get enough sleep, and keep a joyful mindset. Get regular checkups, especially if there's a family history of Alzheimer's or dementia. When memory fades, we lose more than just events. We lose a part of ourselves, who we once were. Don't let the fear of dementia keep you from adopting habits that protect your memory, because only when our mind is healthy can we truly live out our senior years. 7. Cancer, the silent intruder. Cancer is not a disease that strikes you suddenly, like a storm hitting the shore. It is a silent intruder, creeping into each cell, growing slowly, destroying the body while you remain unaware. Some people detect it early, while others discover it too late. But one thing remains constant. Cancer is a shock to life, a challenge that no one ever wants to face. The story of Mrs. Emily, from good health to a cancer diagnosis. Mrs. Emily, 80 years old, lives in Boston, USA. She's a strong, independent woman who enjoys gardening and walks every morning. She's never had serious health issues and considered herself to be in good health. But one day, she noticed a small lump in her breast while showering. Initially, she wasn't too concerned, thinking it might just be a fatty cyst or a bump from her activities. However, she decided to get a checkup, and the doctor diagnosed her with stage 2 breast cancer. What pained her the most wasn't the diagnosis itself, but the feeling of losing control. Cancer had progressed without her knowing. She didn't want to become a burden to her family, but she knew she had to face it head on. The lesson from a late cancer diagnosis. Cancer doesn't discriminate by age, gender, or lifestyle. Many people think they're healthy simply because they don't have any obvious symptoms, But cancer can silently develop from subtle signs. And the most dangerous part is, cancer doesn't warn you. But when detected early, the chances of a successful recovery are significantly higher. The solution: cancer screening and prevention. Get regular screenings for breast cancer, prostate cancer, colon cancer, and lung cancer, especially after the age of 50. Eat a healthy diet, plenty of vegetables, fresh fruits, and avoid processed foods and red meats. Exercise regularly, at least 30 minutes a day, as physical activity helps the body protect itself from cancer. Quit smoking, reduce alcohol consumption. Both are major risk factors for cancer. Maintain a positive mindset, as prolonged stress and anxiety can weaken the immune system. Cancer is not the end, it is an opportunity to live more boldly. If detected early, we can defeat it. Don't wait for symptoms to show up. Get screened today to continue living with health and hope for the future. 8. Chronic pulmonary disease, the silent fading of breath. The lungs are the most important companions in our life, but at some point, the lungs no longer remain as strong as before. Persistent coughing, increasing shortness of breath, these are all warning signs. Chronic pulmonary disease, COPD, is silently creeping in. COPD is not an abrupt disease. It comes slowly, quietly, but destroys the body bit by bit. People who have smoked for many years, those living in polluted environments, are at high risk. However, chronic pulmonary disease can also affect those without bad habits if respiratory health is not properly cared for. The story of Mr. Frank, quitting smoking too late. Mr. Frank, 72 years old, lives in a small town in the U.S. He's always loved sports, having participated in running and basketball when he was younger. But he had one bad habit: smoking for 40 years. As he entered his 60s, he began feeling short of breath when climbing stairs, coughing persistently, and getting tired quickly, even doing household chores. He thought it was just part of getting old, so he ignored it. It wasn't until he went for a health checkup that the doctor told him he had chronic obstructive pulmonary disease, COPD, a disease that causes breathing difficulties due to long-term lung damage. He couldn't believe that his smoking habit had led to this. The doctor said, if you had quit smoking earlier, you could have avoided so many issues. The lesson from a fading breath: COPD doesn't only occur in smokers. However, smoking is the leading cause of lung damage. The disease progresses silently, and sometimes by the time it's discovered, it's already in the late stages, when the lungs have been too damaged to fully recover. The solution: don't let your lungs become a nightmare. Quit smoking immediately. It's never too late to stop. Avoid exposure to polluted environments. Wear a mask outdoors. Limit exposure to smoke and dust. Exercise gently, like walking or swimming, to improve lung strength. Get regular lung checkups, especially if you have a history of smoking or live in a polluted environment. Eat foods rich in antioxidants, vitamin C and E, to protect your lungs from damage. A healthy breath not only helps you live longer, but live stronger. Don't let your lungs fade in silence. Protect your lungs today, so that every breath is a precious gift.